Hi, my name is Leon. I'm a Hatzolah responder, and I'm going to take you through what to do if you come across two of the most life-threatening and time-critical medical emergencies. The first one is your non-responsive breathing patient. For example, if someone has fainted or if they've had a head injury, in which case they're unable to control their airway. The other one is someone suffering a cardiac arrest, in which case their heart isn't beating effectively and their brain is being starved of oxygen, in which case they only have 3 to 4 minutes until their brain starts dying. We're going to follow a process called the primary survey. It's made up of an acronym called Doctors ABCD, where the D stands for checking for dangers. So you're going to check for dangers first for yourself, then dangers to everyone else around, and finally dangers to the patient on the floor. Response, you're going to talk and touch to see if the patient is responsive. If they're not responsive, going to send for help by calling Hatzolah. Then we're going to manage their airway. So that's A, we're going to have a look in their mouth to see if it's clear. If not, we're going to put them on the side and clear the airway out. If the airway is clear, we then tilt the head back to open the airway up, after which we can go to B, which is checking for normal breathing. We're going to look, listen, feel for 10 seconds to see if we're hearing 3 normal breaths in an adult. If we do hear 3 normal breaths, we're going to roll the patient over into the recovery position, in which case their airway is protected. If they're not breathing normally, we're going to start CPR, which is made up of 30 compressions and 2 breaths. We're going to do compressions at a rate of approximately 100 per minute, pressing down about 1/3 of the chest height. You're walking down the street, you come across someone who's lying on the floor. First thing you do is check for dangers to yourself, bystanders, or the person on the floor. You're then going to check, are they responsive? Hi, I'm Leon, can you hear me? No response, ask them to squeeze your fingers. Non-responsive. If they're non-responsive, you're going to call for help. Call Hatzolah's number. Then we're going to check their airway, have a look inside their mouth, make sure it's clear. If it's not clear, roll them on the side and clear it out. If it is clear, grab their forehead, tilt their head back. Then going to do check B for breathing. We're going to look, listen, feel for 10 seconds. Should feel and hear and see 3 normal breaths. In this case, we have heard 3 normal breaths, in which case we need to roll the unresponsive breathing patient onto their side. Tilt their mouth down a little, so anything in their mouth dribbles out. And from there, we can keep monitoring and measuring their breathing. In the second scenario, you're walking down the street, someone's lying on the floor. Again, check for dangers to yourself, anyone else around, patient on the floor. Response, hi, can you hear me? I'm Leon. No response to talk. Ask them to squeeze your fingers on both sides. Non-responsive, call Hatzolah or get someone else to call Hatzolah. Airway, have a look in their mouth, nice and clear. Grab their forehead, head tilt back. The airway is now open. Breathing, we're going to look, listen, feel. 10 seconds, should hear, feel, see 3 normal breaths. In this case, there's no normal breaths heard. So we're going to use the heel of our palm, nipple line, center of the chest. Lock your shoulders above the chest, so you can use as much of your body weight to help you as possible. We're going to do 30 compressions, going down about 1/3 of the chest height. After you've done your 30 compressions, pinch the nose, tilt the head back, 2 short breaths, and back to your 30 compressions. If you choose to do breaths, then make sure you're not overfilling the lungs, because excess air will go down the stomach and cause the patient to regurgitate. If you're not comfortable doing breaths, or if you're there alone, then just continue doing compressions. Don't stop after every 30 compressions, just keep going. If you come across a child, it's exactly the same technique. Heel of your palm, center of the chest, nipple line, 30 compressions. If you're doing this with breaths, do your 30 compressions, then 2 breaths. If you're doing this without taking breaths, just keep going until help arrives. And all the rest is exactly the same as for an adult. You approach a non-responsive child, we're going to follow primary survey just like we do with an adult. There's 3 main differences. Where if we need to do rescue breaths, we're only going to do puffs, a cheek full of air into their mouth. Only going to use 2 fingers for compressions, and we're never going to do a head tilt. A baby is defined as under 1 year old. You approach the child, checking for dangers, pick up the child in this position, If we're checking for response as we're doing that, the child should move. If they haven't moved, they're non-responsive. Send for help to child, so you can walk over to a phone, scream, or get someone else to call for help. Airway. So with an adult, we check the mouth and do a head tilt back to clear and open the airway. With the baby, we've already got them in this position. Anything in their mouth will come out, and their tongue is away from the back of their throat, so the airway is open without having to move them. Breathing, I've got my hand on their tummy. I can feel if they're breathing, so feel for about 10 seconds. If I'm not sure, I can wet my finger in their mouth and feel if there are any breaths coming out of their mouth. If they are breathing normally, then we have them in the recovery position. So they're in a safe position here. Their tongue is away from the back of their throat, their airway is open, anything in their mouth will dribble out. We can monitor the baby's breathing in that position. If the baby is not breathing normally, find a hard surface, put the child on their back on the hard surface, use your 2 fingers, nipple line, center of the chest, 30 compressions, about a third of the chest height of the baby down, at a rate of 100 a minute, just like with an adult. After 30 compressions, 2 puffs in their mouth without any head tilt. When you do your breaths, you're going to cover both their mouth and their nose. And continue till Hatzolah arrive. We are the first link in what's called the chain of survival, which is early access, early CPR, early defib, and advanced medical care. It's imperative that we start CPR as soon as possible, even if you've called Hatzolah. Every minute that CPR defib is delayed is a 10% less chance of survival for your patient.